So I'm delighted to be here today to launch the Centre of Excellence across our region in Humber and North Yorkshire, stretching from Harrogate all the way down to North Lincolnshire. I'm here at the Jean Bishop Integrated Care Centre, and we're building our Centre of Excellence on the back of 6 years of really hard, innovative, dynamic work.
Our health is about a lot of things: where we happen to be born, what our education happens to be like, how good our parents manage to be. All these things impact our health, and there's recognition that those things don't all fall within the remit of the NHS. So how do we enable babies and children to start well in their lives? How do we then go on and live well during the course of our lives? What can we do to make sure that the ageing process enables us to live well and independently? How do we ensure that when end of life comes, it's the best death that can be managed? Again, potentially closer to home, with care that's wrapped around you at home rather than you finding yourself in a hospital. We're also concerned about the difference in healthy life expectancy. So in more deprived areas, we see people become more frail and begin to suffer with ill health in their mid-50s, where in a more prosperous area, that process might not begin till someone's in their 70s. And one of the absolute objectives of our integrated care system is to balance that out. And those are our ambitions, that we level out this difference in life expectancy and we level out this difference in healthy life expectancy.
So it's all around identifying people living with frailty, knowing what their wishes are, which generally is around independence and well-being, but really understanding, our needs of our frail population and how we can support them better.
It's about how we join all this up as a system, not automatically send everybody to hospital. We've got the evidence base to say it's not just the right thing to do economically, but from a patient perspective and their family's perspective as well.
But what we really want to be as a system is in a place where we're expanding those healthy life years of an individual as they age. So their time spent living with severe frailty is decreased, but their healthy time is increased.
So this model of anticipating illness before it happens, preventing illness, caring for people in a way that enables them to stay at home is absolutely the preferable way.
I'm used to doing everything myself, but things have got more difficult now. It takes longer and it gets more difficult to do things, you name it, I've got it.
Somebody might, have a fall. We can look at, how can we try and prevent future falls, but also support them still to potentially stay at home if that's what they want, or have short periods of rehabilitation again, but trying to support them getting back to being as independent and well as possible.
But he is getting to the point where we just need a little bit more help. So that's why we've accessed the Jean Bishop Centre to keep him in his own home, really, for as long as we possibly can. His mobility is getting progressively worse. They've given him a frame with skis on and all that sort of stuff and everything. They've just been absolutely fabulous.
What's really heartening, I think, is that everybody seems to have left their organisational hat at the door. And they're coming together to do this because it's the right thing to do.
We're actually just one team working together, providing that seamless care for patients with frailty through both anticipatory care, crisis response and getting them out of hospital. And then what do we need to do to wrap services around them once they come out of hospital to try and prevent them from going back in again.
So it's taking all the ideas, innovations that are working in these different places to improve outcomes and improve the care of people with frailty, bringing those leads together to be able to understand what's working well, what could we do differently, how can we learn from one another, share that best practice and ultimately improve outcomes.
If you have frailty and you live with frailty, we can offer the same response irrespective of where you live across the board.
They get to see one doctor who understands and knows their case, who can manage all the elements of their condition. So it's a really, really efficient way of treating patients, but it's also much more user-friendly. So much easier to come to one place and have all your needs met than find yourself with multiple appointments going to different places.
It's good, yeah. I'll give them top marks for that. They've sort of got charm for you, and they don't choke over you like a lot of medical people do with long words and things. They say it as it is,
The communication between themselves and me is absolutely amazing. They're just, yeah, top notch. Can't fault it.
Everything these people have promised, they've done. You know, can't fault them.